Hey everybody, it's your girl Jacqueline Chantel.
And I'm Shay, and you're watching Elevated State.
So, we do have a special guest for today. So our guest for today is going to be Carice Peters. She is in the medical profession. She'll be talking to us about breast cancer, and how to do a self breast exam. I just wanted to share, why breast cancer is so kind of close to me. I know we all have like our stories, but my grandma died of breast cancer, and I just remember, I was young, so I knew she was sick, but I didn't know like the extent of it and how serious it was. And for some reason, I always thought that like breast cancer was one of the ones. I guess it does have a higher survival rate than other cancers. I just remembered like that, you just get your breast cut off, and that I thought that she would survive. And just watching her, get sick, go through chemo, get her breast removed. I remember going over there with my mom and like staying the night with her and stuff like that, and watching her not make it. It's just it's traumatizing in a way, because like I really, really love my grandma, as we all, love our grandparents. And then I was like, okay, this is hereditary. So as I got older, it made me like kind of like, be concerned about it. We thought it would be a good idea to share with you guys. So without further ado, we'll let Carice take over and give us a little bit more information about breast cancer.
So, my name is Carice Peters. I am a nurse. I've been a nurse for 19 years, working in long-term care, working in hospitals, working in clinics. So basically everything. So, but today we're going to discuss breast cancer. And breast cancer to me is very personal. Like, I've been an advocate for probably the last 6 years. It all started when my younger sister was diagnosed with breast cancer at 33. She fought it for 3 years. She passed away at 36. And so from there, I just been an advocate with breast cancer, and just getting the word out, letting like African American females know how to get their breast exams, how to get their mammograms, how to do self-breast exams. So I'm going to share my screen, see if I can find it. Let's see. Okay, there it is. Okay, so this is the breast self-exam. So it says you should start doing your own breast exam starting in their 20s. And so I'm just going to show you how to do it. First is like first step, second step, third step. And then when you should go get a clinical exam, which is your mammograms, your CT scans, ultrasounds. You should start getting that at the age of 40. But if you feel, if you have a family history, or if you just feel any unusual lumps or discharge, you need to go get your breast exam prior to 40. So we're going to go over how to do a self-breast exam. It's actually not the one that I want. But so you can start off in the mirror. You want to be naked. Start off in the mirror. Have your hands up. Oh, can you see my hand? You're going to have your hands up and like behind your head. And then you want to start in like circular motions, going around your whole breast. Start at the outer edge of your breast. Move your fingers around the entire breast in circular motions. Vertical, you want to start at your underarm area. Move your fingers downwards and back up until you have checked your entire breast. And while you're doing it, if you feel any unusual lumps or if you see any discharge, then that's something you want to go get checked out immediately. And then Wedge is called a wedge. It's basically to the same thing. You want to start out the outer edge of your breast, move your fingers toward the nipple, and back to the edge until you check the entire breast in small wedge-shaped sections. And it's also good to do it laying down and in the shower. You use the pads of your 3 middle fingers to feel your breast and do those motions. So the clinical breast exam that I was talking about, women in their 20s or 30s should have their breasts clinically examined, and that's just going to the doctor and having the doctor do basically a self-breast exam on you. She'll do it more firmly. She'll press down a little bit harder, but all women 20s or 30s should have their breasts clinically examined by a physician or a nurse practitioner. Second, I want to talk about mammograms. Like I said, anyone over 40 and up needs to be having their mammogram done every year, regardless. Before 40, like I said, if you see any discharge, unusual lumps, you need to be having a mammogram done. Most insurance tell you not to, but like I said, if you feel something is wrong, don't wait, because cancer do not wait. So you need to talk with your doctor, physician, nurse practitioner, and they can advocate for you and for that insurance to pay for your mammogram if you're under the age of 40. Next, about mammogram. When women have mammograms, sometime on their mammograms, it'll state that you have dense tissue. That's not an indication of cancer. It's just that your breasts have more fatty tissue, and it's harder for the mammogram to see what's underneath that fat. So some doctors may require you to have like an ultrasound so they can see further into that. I would say 1 out of 5 women will come back with dense breasts. And like I said, if your doctor, when they do the mammogram, they look at the mammogram, and if they can see it clearly, even through the dense tissue, they, most likely they won't tell you to go get an ultrasound. But if they have any discrepancies, because dense breasts and tumors show up the same way on a mammogram, so they may have you go do an ultrasound. Let's see. I just encourage all women, like I said, if you have any young women in their 20s, in their teens, I would start talking to them about doing self-breast exam, because it's more than 40 that are getting breast cancer. And they are catching it in time, and you can fight, you can survive it, but it's all about, doing those exams and catching the cancer in time.
Why is it that, is it a reason, like a medical reason or something, that insurance companies or a lot of doctors will say, like, wait till you're 40, wait till you're 40? Is that when it's more likely?
Mammograms are expensive. It's all, to me, about money, because mammograms are expensive and insurance don't want to pay. So like with me, like I had the same issue. I had to fight to get a mammogram because I wasn't 40. I didn't have any symptoms or anything. I didn't have any lumps, but I had a family history. My doctor was able to get the authorization. I mean, it took weeks, but we were able to get that authorization for me to have a mammogram. Even with my daughter, I had to fight to get, the insurance to pay for it. Because some people, like with my daughter, when she had her menstruals, her breast was very tender. With me, I didn't want to take any chances with family history, so we went and got a mammogram. Her insurance actually was a lot quicker than mine, but they approved it. But yeah, it's all about money. And like I said, they're expensive. And insurance don't want to pay for it. I think is, even with the pharmaceutical companies, they get paid more to treat a problem instead of preventing it.
Oh, wow. And then what about as far as like prevention, or is there anything
Prevent the
that,
whole situation.
I'm sorry, is there anything that like can prevent breast cancer? Or I know that I hear a lot that breast cancer is hereditary. Are there any other ways that someone may get breast cancer?
Um, using using birth control has been linked to breast cancer. The hormones um, has been linked to breast cancer. Now coming out, a lot of these medications have a lot of um, cancer agents in them that they're pulling off the shelves that can be linked to breast cancer. Environmental cancer agents and hereditary hormonal cases. From when I started using birth control, like 20-something years ago, is no longer, all of that has been pulled off the shelf because now all of a sudden it has all these cancer agents in it, but these are the birth controls that we used to use. And so that's why I think I see a lot of younger women.
Okay. And what is the age that you would recommend? Like, how young would you recommend to start doing self breast exams, or is there a minimum age?
A family history, a close family history, say like your mom or your sister, and you're younger, I would start young. Like I teach my niece to do it. She's 10. Unless you have like I said, a close family member who has had it, then you want to start as young as possible because you want to catch it as early as possible because it spreads quickly. You have some breast cancer that just stays right at the source, and then you have some breast cancer that just it just spreads quickly to the other parts of the body. So I think the earlier you catch it, the faster you treat it, and your survival rate is higher.
Okay. All right. Well, I think you covered all of the questions that I had. Did you have any last reminders or anything you wanted to share with the audience that's watching?
Just every time you get in the shower, you should be showering daily. Do a breast exam, a self breast exam. That's all you need. It doesn't take no time, less than 5 minutes while you're in the shower. Just go around your breast, make sure you don't feel any lumps, and if you do, don't put it off. Just go get it checked out, even if it's nothing. Go get it checked out because it's that's all. Just especially African American young ladies, do your self breast exam. Don't wait till the last minute. Don't think it's nothing. Don't think it's because I'm on my period. Go get it checked out.
All right. Well, thank you, Carice, for joining us today and giving us some information on breast cancer. Of course, we look forward to talking to you soon. We'll probably have you on many more of our podcasts.
All right. Thank you, ma'am. Enjoy your day. I love you guys. Hi, Jackie. Hi, everybody. Take care of your breasts. And be safe.
Okay. Bye.
Bye.
Doing those self-exams, be at the age of 18 or even younger if possible. Teach your children how to do it. I know my mom taught me at a very young age to do it when I was in the shower or laying down. Just make sure you guys are doing this as often as possible to make sure that you are safe.